Bonnie, first and foremost, is a friend of British Columbians and a friend of all Canadians and a friend of anybody in the world who might have been impacted by this pandemic. She has been to the coalface and seen Ebola and seen it all. And so she knows how bad this has been and can be. And so I think she has an ability to kind of look beyond the boundaries of individual professionals and look to what is needed to get the job done. And so she really has no hierarchy from what I can see in terms of who she calls on to be part of the solution. And so pharmacists are there, they're in every community, and they're a respected professional that of course it made sense to use.
As we continue to move forward in our COVID-19 response, it's important that we don't leave anyone behind.
She kept all of us citizens of BC calm through something that none of us have ever experienced before, and I think we're hoping we never experience it again. And I think she really lent all of us confidence that BC was headed in the right direction.
Bonnie has always known frontline healthcare, primary care is extremely important to public health. And as a result, she knows the role pharmacy plays and how significant we have contributed to frontline healthcare and engagement with the public.
I think when we think about pharmacies, it is a community, neighborhood thing. So people go in and get advice. They build relationships with their local pharmacists. And that's been really important in supporting people, especially when many medical offices were closed for a period of time. And so that relationship is really important. And those are the types of things that I see all the time. Both relationships between providers, so physicians and pharmacists. The pharmacists that work in our hospital system have been on the front lines of this, experimenting with the different medications and combinations that we have to try and support people with COVID. So it has been a journey that we've made together.
Even prior to her current role as Provincial Health Officer, Bonnie was part of CDC, the BC CDC. So as a result, she understands the role that pharmacy plays because as part of CDC, we helped with the public flu vaccination program for a number of years.
Is such a key role in communities that people can go in and get advice from their pharmacist, they can get vaccines, they can get medications that they need. So I am very, very grateful for the work that pharmacists have done. And now that we've moved into immunization, it's been a bit more of a challenge. And part of that challenge is because we have an immunization registry in BC, and we needed to make sure every single dose of every vaccine and every lot number got into that immunization registry. So it has been great to have pharmacists as partners again, and they've been fabulous in coming into our vast clinics and being immunizers, and I am so grateful and appreciative of that. And now we're getting the IT systems in place to support pharmacists giving booster doses and giving COVID vaccines as we go forward as well.
You stating that is making me feel very warm inside because I don't know how much pharmacy gets acknowledged. It's not often that pharmacists get recognized at a high level for clinical work. And so to have somebody appreciate us in that way, I think is fantastic. And I think it's another testament to her leadership, and it speaks to our path forward as well, and our abilities to continue down the clinical path and providing good quality care to the public.
Yay, Bonnie Henry, absolutely. Yay, Dr. Henry.
Bonnie, thank you very much for your leadership and taking charge in just challenging times.
You know what? I am really humbled and grateful. I've been a strong supporter of pharmacists as immunizers, as an important part of our program across BC and across Canada.